Let's study spinal reflexes. And under spinal reflexes, we have mainly two type of reflex. First is stretch reflex. The other one is called the inverse of stretch, that is called inverse stretch reflex. And then we have something which are other reflexes which are not so important. I mean, they are important for your body, but they are not frequently asked, I think. So that's why they have less weightage. Other one is withdrawal reflex. I'll tell you what withdraws. Second is supporting reflex. Third is the placing reflex. Fourth is writing reflex for the cat, hopping reflex for the cat. I have a cat and I can see it right now, like my cat does hops when I try to mimic this reflex. The sixth one is mass reflex. We call this mass reflex because a lot of number of spinal segments are getting activated in this reflex, so we call this mass reflex. Okay, so spinal reflex, why we need these reflexes? We need these reflexes so that we can have reflexes. Why they are reflexes? We need reflexes because we don't want to spend a lot of time thinking about some sort of movement, some sort of movement. For example, if we need reflexes so that we can dodge things, we need reflexes so that we can reduce the time, we can reduce the computation time for you to perform any sort of movement. It should be a reflex because it saves you time and it saves your life. So that's why we need reflexes. And the important thing about reflexes is that they are the center of reflexes is always spinal cord. So that's how you save the time. The afferent fibers, they don't the information, they don't go to your cortex, the brain. They just go to your spinal cord, the local spinal cord at that level, and from that spinal cord the efferent comes out to the muscle and performs the respective reflex. So that's the whole story of reflexes. Three type of reflexes: stretch, inverse stretch, and then the other reflexes. Okay, so how do we perform reflex? Okay, so there should be some sort of stimulus that is happening, and after this stimulus should be picked up by a sensory receptor, and after this receptor should send the reflex, the information, not reflex, the sensory receptor must send the information via an afferent fiber, and this afferent fiber must go to your spinal cord, that's the center of reflexes, and then after this it goes to the efferent, the output, right? And the computational unit is right there. And then this efferent fiber goes to your muscle, and then in muscle we have a lot of sensory receptors or sensory organs, and in the muscle they sense, and then we can perform the respective reflex. So that's the whole story of it: stimulus, receptor, efferent, spinal cord, and then the effect, the reflex itself. Okay, so that's the basic outline of reflex. How, why, that's what happens. So let's start about stretch reflex. Well, the name says stretch, it means your muscle will stretch. Okay, so why we need this reflex? We need this reflex because I will tell you why we need this reflex. First, let's try to understand what is this reflex. Okay, so this is a stretch reflex in which stimulus comes and it hits you up, and then your reflex is the stretching of the muscle. Okay, so this is the reflex. We call this passive reflex. Why we call this passive reflex? We call this passive reflex because the muscle stretched out using its own resources, okay, using external forces. Okay, we use external force as stimuli, and then the muscle performs the reflex. So that's why we call it passive reflex, because we as a body are not using our own energy for performing this reflex. Okay, so stimulus, it comes, it hits us, and the stimulus is for the passive reflex. What passive reflex? Passive reflex is the length of the muscle, it changes. Okay, and this is a passive reflex. Again, it is done because of the stimulus, and we don't use our own energy for this reflex, so that's why we call it passive. And then this muscle strengthening, this muscle length changes, and this is passive stretch. Okay, so this stimulus comes, not arrives, this comes to you, it arrives to you, and via the sensory receptors. Which sensory receptors? Receptor number 1A and 2. There is no 2B right now. We'll talk about 1A and 2. That's it. So it goes to 1A and 2, and then it goes to your local spinal cord, and then it goes to motor efferent, and this is the motor efferent output, and then it goes to alpha motor neuron, and then it goes to effector, and then extrafusal fiber, and then eventually the muscle contraction. You must be thinking, what is this? What is this? Just remember that stimulus goes to receptor, receptor goes to spinal, spinal eventually goes back to the muscle, and then muscle contraction happens. I'm going to tell you about all these steps one by one. Cool. Let's start with the receptors, the first topic. I mean, we know the stimulus. The stimulus is external force. We can use a hammer or something. We don't want to like destroy the knee. We just want to slightly hit it lightly. So the receptors used for this arc is muscle spindle, okay, and these are the sensory receptors used. How? Well, we'll study about this. Let's see what are these. So these are two muscle receptor, 1A and 2. These are sensory afferent. Where are they going? They are going to muscle spindle. What is muscle spindle? Well, muscle spindle is like a, it's like an organ, okay. It's like a machine that measures how much the length of the muscle is changing, okay. So for example, this is your muscle, right? Cool. This is your tendon, okay, cool. This is the muscle unit, okay, cool. Now it has something called as extrafusal fiber and intrafusal fiber. Well, intrafusal fibers means they are fused inside, extrafusal means they are fused outside. Okay, we understand this. What about, do you guys know about actin and myosin? Well, actin and myosin, they help to perform something called as contraction. Well, contraction of the muscle, it means the muscle shortens. Well, if the muscle is shortening, it means the length of the muscle is changing, right? And if the length of the muscle is changing, it means we need some sort of instrument that can measure the length of the muscle. And what instrument that can measure the length? We call this muscle spindle. Okay, so we have now muscle spindle, actin myosin, and we have these things, right? So actin myosins are innervated by extrafusal fibers, because actin and myosins are presented on outside here, okay, and these actin myosins are innervated by alpha motor neurons, okay, and the muscle spindle that measures how much the length of the muscle is changing, they are present at the periphery of this muscle, okay. They are present at the periphery, and they are fused by intrafusal fibers, and they are fused by gamma motor neurons, okay. So gamma motor neurons innervation goes to intrafusal fibers, and then intrafusal fiber they innervate the muscle spindle. So from this we can understand that muscle spindle is right here, actin myosin is right here, and we know that alpha motor neuron is coming outside extrafusally, and this gamma motor neuron is going inside, and that's why they are intrafusal fiber. Okay, so you understand the connection between these things, right? Cool. What about sensory innervation? How do we sense? Well, we have two type of innervation. They are present at the center, at the muscle spindle. Okay, what are these two? These two are 1A, group 1A and group 2. Why we need them? We need that so that the information via stimulus, information of the stimulus can come to this muscle spindle. I will tell you why we need to put muscle spindle in this equation, because muscle spindle actually is like is looking, is making sure that muscle is strengthened at all time. The tonicity of the muscle is all right. So that's why we need, so these sensory innervation, they innervate the muscle spindle, okay. So here's the concept. Stimulus goes to these sensory innervation 1A and 2, and then this sensory innervation goes to muscle spindle, okay, and then this muscle spindle rather can decide if it wants to increase the tone or decrease the tone, or I'll tell you what happens, okay. So this is the whole concept. Okay, so muscle spindle. Okay, why we need muscle spindle? We need muscle spindle so that we can calculate the tone of the muscle all the time. Okay, all the time. That's very important, because if your actin myosins are acting up and your muscle is shortening, or they are contracting, the muscle spindle, they like contract as well, and then the muscle spindle can understand what's really happening, okay, at this time. So gamma neurons, gamma motor neurons, they go to intrafusal fiber, they go to muscle spindle, and then why the muscle spindle we need there? Why the muscle spindle is there? Why? Well, muscle spindle. Well, if the muscle is stretched, the spindle is stretched as well. Okay, the spindle says, "Oh, help! I am being stretched." To the spinal cord, it goes the afferent from the muscle spindle that goes to spinal cord, and then the muscle spindle says, "Hey, help! I am being stretched." And then this message goes to spinal cord, and then spinal cord performs something called as jerk knee reflex, this stretch reflex, and then this alpha motor neurons, extrafusal fiber, they perform this contraction, right? Because muscle spindle told spinal cord to perform this, and from spinal cord to alpha motor neurons, the contraction happens, and then muscle shortens, and then the spindle, it loses its density, and then this muscle spindle shortens, and it becomes like this, and then there is no tension, and it goes slack. Okay, so if it goes slack, the muscle spindle will slack, right? And we don't want that. If it goes slack, we want the muscle spindle to be aware, to be activated all the time. Cool. The slack spindle is insensitive to the tonicity of the muscle. It won't be able to understand if the muscle is all right, right? We need a sensor in our muscle, and that sensor is the muscle spindle itself. So can't detect any stretches now because the muscle is shortened right now. The muscle spindle is shortened right now because it has gone slack. Okay, it has gone slack. Okay, so it can't detect any stretches now. No proprioception information from your muscle spindle will go to your cortex, and you will not be able to understand, okay, what is the proprioceptory, where is your knee, where is your elbow, what you won't be able to understand what is happening around, right, whenever your contraction of any sort of muscle is happening. So this is why we need muscle spindle, because it makes sure that our proprioception is working nicely. That's the main reason why muscle spindle exists. Okay, so this is the job for gamma motor neuron, of course. So gamma motor neurons, gamma fibers are intrafusal because gamma keeps the spindle tight, and it keeps the spindle sensitive even when the muscle is shortening, even when the actin myosin are acting up, even when the muscle is contracting. Gamma fibers, they keep the spindle sensitive, and we call this alpha gamma coactivation. This is the concept behind it. Okay, so what are the types of muscle fibers or muscle spindle? We have two types. First is nuclear bag fibers. It means a lot of nuclear bodies are inside a bag. Okay. We have two types of nuclear body: static bag fibers, dynamic bag fibers. Static bag detects the absolute length of the muscle, the final length of the muscle. Dynamic bag, it calculates the rate of change in the length of muscle is happening. Okay, so this is the dynamic bag concept. Okay, what about second one? The second one is nuclear chain fibers. Well, a lot of nucleus are put in a chain like this, okay, on a consecutive order. So they are less sensitive to velocity, and they are more sensitive to the stretch. They are more sensitive to the stretch and less sensitive to the velocity. It means the rate of change, they will not look it up, but they will look for the final length. So final length is covered by static and chain. Okay, cool. Now we understand the concept of muscle fibers, actin myosin. We understand muscle spindle. We understand gamma fibers. We understand alpha fibers. We understand sensory innervation. Okay, so innervation, I told you already. Innervation, we have what innervation, by the way? Innervation called group 1A, group 2B. These innervation are taking information from the stimulus to the spindle. Okay, and then from the spindle, these information, they go via motor efferent. Okay, so sensory afferent, we have 1A, 1 and 2. 1A is annulospiral. Annulospiral means there's like a stick right here, and then this fiber is going like this in a spiral across the muscle spindle. Okay, and these are primary, it means they are faster. And then other one, group 2, is flower spray. It sprays like this at the end of the muscle spindle here. And these are secondary, it means they are slower, little bit slower. And these are more myelinated, these are less myelinated, I think. And they cover this one cover static. Static means the length, dynamic means changes, and NCF, it means this chain one. So primary is covering all of the muscle spindles. Okay, and group 2 is covering only static, this static and NCF, this one. It's not covering the dynamic bag. Okay, because dynamic needs faster muscle fibers, so dynamic needs primary muscle fiber, primary sensory fibers, right? That's why we only see group 1A in innervating dynamic bag fibers, right? DBF. Okay, so from the muscle fibers, we have something called as motor efferent fibers, and these motor efferent fibers are two types: alpha, and then we have gamma. Okay, and alpha is for actin myosin, and gamma is for it's for muscle spindle itself, right? So gamma motor neuron, it goes for the periphery of location of the muscle right here. So I make this, so this is a muscle, right? This is the periphery. Okay, this is a spindle, this is a muscle spindle. And so this is afferent and this is efferent, right? And this, we have alpha, this is for actin myosin, and then we have gamma, it goes here on the periphery, so that it can calculate the length of the muscle all the time, right? So gamma motor neuron supplied intrafusal fibers, right, because it's inside, and alpha, it supplies extrafusal because it's on the outside, the actin myosin, because we need actin myosin on the outside so that the contraction of the muscle can happen. So gamma, it works for dynamic end plate. Of course, dynamic, it changes the length, and static, it means the dynamic means the speed of change. Okay, and static is the total, the final length. Okay, so gamma motor neuron interfuse DBF and SBP and NCF. Okay, DBF, DBF and SBP, not SBF, SBP and NCF, this one. So gamma motor neuron is innervating almost everything, right? Okay, so we now understand motor efferent, alpha gamma motor neurons. We understand the innervation 1A and 2. We understand muscle spindle, we understand myosin actin, we understand how this basic stimulus happens. Okay, so this is the overline. Afferent sensory fibers are 1A, 2, and then they go to the spindle itself, and then from the spindle there are efferent fibers, alpha motor neurons, and then this response of muscle contraction happens, right? And these are extrafusal fibers because the contraction is done by actin and myosin only. Okay, so response is alpha gamma coactivation. I already told you the concept of why it happens. Here I told you, here, right here. And gamma is for periphery, alpha is extrafusal. Always remember this, because gamma, we need gamma at periphery of the muscle because we need to calculate the length of the muscle at all the time. That's why gamma is present on the periphery. Why alpha is extrafusal? Because if alpha goes to intrafusal, then we won't have any sort of fibers connecting to actin myosin, and actin myosin are present on extrafusally, right, outside, not intrafusally, because intrafusally we have muscle spindle. Okay, so contraction can be direct. Direct is alpha motor neuron working. Indirect means gamma motor neurons working. Okay, gamma innervates peripherally, center portion stretch happens, stretch reflex occurs, and then muscle contracts. So we need gamma and we need alpha, both. Okay, this is the whole story of coactivation. Okay, so applied concept, this is the applied concept. Alpha motor neurons, actin myosin at rest, flabby on contraction, the muscle spindle gets flabby on contraction, and the gamma motor neuron action starts, and then it keeps make sure that the muscle spindle is tight, because we need the muscle spindle to be tight and taut, so that our information from the muscle goes to our CNS and our proprioception is working nicely. So that's the concept. Okay, we can also perform something called as Gendrasic maneuver. It is done so if so you meet someone and you try to perform this knee jerk, and you see the knee jerk is very weak. So I think the person can be stressed as well. So when you're really stressed, the knee jerk will be, knee jerk will not be performed very well. So once you tell the person to clench his teeth or to interlock his fingers like this, the stress of the person will be dissipated, because he's clenching the teeth and he's interlocking the finger. He's spending some sort of motor energy on doing this, and this will help us to reduce the stress of the patient. And then followed by this motion, we can directly tell the person to perform, we can perform knee jerk by hitting it on a patella. And then we do this, and then we see something called as brisk knee jerk reflex due to alpha and gamma motor neuron coactivation. We see this. So reduce the stress first, and then right away do the knee jerk, and you will see the knee jerk is happening. So this is called Gendrasic maneuver. Other thing is called inverse stretch. Why we need inverse stretch? Well, stretch is that the contraction of the muscle is happening, right? So inverse means relaxation is happening. Why we need relaxation? We need relaxation because we don't want to hurt ourselves. It's a protective reflex, relaxation after overstretching of the muscle, because overstretching can cause injury. It's a protective reflex. We can see this happening in snatch. If you guys know about weightlifting, they have something called as snatching. I love snatch. So whenever you pull the weight up in the up in the air, and then right away you will try to drop the weight because of this protective reflex. This happens when you do weightlifting, when you do jerk movement and snatch and jerk, and this type of weightlifting movement when you do. So this is what happens when you're trying to do protective reflex. The receptors for protective reflex is called Golgi tendon organs, GTO. These tendons, they are tension sensing organ. They are located at the tendon. That's very important, because Golgi tendon organ, always remember, tendon organ present at the tendon. And they are called Camilo-Golgi. Okay, so Golgi tendon organ afferent means they are going inside, right? And from this receptor, it goes to spindle, and then the protective reflex happens. So group 1B here, 1B. So I told you, here is 1A, 2 for stretch, for the stretch reflex. Okay, for the stretch reflex we have 1A and 2. For the protective reflex we have 1B. Okay, that is very important. This is very important. 1B. So 1B, what 1B does, 1B inhibits alpha motor neuron. So we know that alpha motor neurons, they promote contraction, and if we inhibit this, it means no contraction will happen, and then we will have opposite of stretch, opposite of contraction, that is relax. That's what gonna happen. Cool. Okay, what happens? The scheme of the whole thing is that we follow from 1 to 4. Okay, we have something called as group 1B, because 1B goes to Golgi tendon, GTO. Okay, so 1B goes to Golgi tendon, and it's an inhibitory neuron. It inhibits alpha motor neurons, and once they are inhibited, we will see a response that is called relaxation, right? Okay, we see first synapse between group 1B, and we see second synapse between inhibitory neuron and alpha motor neuron. So we have two synapses here. So it's a disynaptic, reflex. Okay, so here's another concept. If you have more synapse in a reflex, the slower the reflex will be, okay? Because we have more train stations. This is one train. Imagine we have two types of trains, right? We have one is express train, and then we have local train, right? So you sit in a train where it stops every time when there's some sort of station, right? And then imagine you have an express train. It's right away goes from point A to point B. Okay, so this one has more synapses. It means it's slower. Okay, so this is the concept. So response is relaxation. Let's see, summary is high yield summary. And so now we have something called as summary of this thing. Summary, we don't need summary because we already understand it. But okay, stimulus, we have stretch, performs stretch. Uh-huh. The stimulus is, if we do overstretch, this reflex will be activated. If we do stretching of the this, you know, uh, the stimulus is stretch here. Stimulus is overstretch. You understand it. Receptor, we know muscle spindle. It's Golgi tendon organ. It's a tension receptor because T is stand for tension, T tendon. Okay. Spindle for length, LE. Cool. Sensory input, we know 1A, 2B, sorry, 1B. Center is spinal cord. Here is also spinal cord because there's a reflex. Motor output is alpha motor neuron is stimulated, alpha motor neuron is inhibited, so that we can have something called as relaxation. The response here is contraction. Here is the response. Relaxation. Other names are myotatic reflex and lengthening reflex. Lengthening reflex, so that it lengthens. Lengthening. Okay. Again, here myotatic means it shortens. Okay, and lengthening means it's opposite of shorten. It lengthens, it increases the length, it relaxes. Okay, number of synapses. Monosynaptic, it's really fast. Disynaptic, it's a little bit slower than the monosynaptic reflex. Okay, now you understand this, right? What about clinical aspect? Well, we have something called as clasp knife spasticity. I don't know if you have seen a clasp knife. It's like a knife. It's a little bit it's a knife. It's a little bit tough to open this knife, and once you cross that threshold part of the knife, the knife opens very easily. So initial resistance is there due to stretch reflex, right? And after this threshold, the resistance of the knife, it decreases. Resistance of this whole thing, it decreases. It called inverse stretch. It relaxes. Ankle clonus. Ankle clonus is, what is clonus? Clonus is cycling of stretch and inverse. Stretch and relax. Stretch and relax. If it's happening, it's a sudden sustained stretch. For example, you twist your ankle, and suddenly you need to relax. So this is what happens. The ankle clonus. Okay, other reflexes. These are very simple reflexes. Something called a withdrawal reflex. One leg is in a flex position, other legs is on an extended position, so that your body can balance. The affected leg will be in flexion. This one, it's flexing towards the body, so that the center of the mass of the body stays normally. Flexor goes up. Painful stimulus here, and you see something, you want to like balance yourself. It's usually done for balancing your body, and this balancing leg, it extends, and the extensor muscles goes up. Okay, it's a polysynaptic. It means a lot of synapses are happening, so it's a slow reflex. It's slower than this monosynaptic reflex. Okay, small after discharge, as makes your hands. Okay, we'll about this myogram flexor reflex. So myogram, it means the muscle graph. That's myogram. Okay, so flexor muscle, we'll see. So when we flex, whenever we touch anything hot, no latency, because we want to take away our hand immediately. First and earliest response. It's really fast. It's monosynaptic. There is no fatigue. There is after discharge, to move a limb away from bone. This is a little bit discharge, very less, not a lot of discharge. Okay, what is discharge? It's like when you realize that, okay, you just did some reflex. This is the discharge part. Okay, you just realize this. So it's a small discharge. It's a small discharge. So we move our limb away from the pain stimulus. It's really small. What about extensor? When we use extensor, well, the latency, it means it's not fast, because it's polysynaptic reflex, and the latency is present. And as it's a multisynaptic pathway, each synapse adds about 0.5 millisecond, must inhibit the flexor. Okay, if it's extensor, it must inhibit flexor. Okay, so what happens? Latency is there. It's slow because of many synapses, and this synapse is done. Stimulus is done here, and then there is this latency phase, and then the whole thing is done. Okay, after discharge, to maintain the posture, the discharge is long. Okay, that's what I'm saying. You realize that Okay, the time period of realization is long, the discharge is long to maintain the posture of the balance. Okay, this is the myogram of extensor. What is the extensor? This is the extensor reflex. Okay, your this limb is extending. This is the extensor reflex. Okay, what about positive supporting reflex or magnet reflex? It's like your feet are becoming like a magnet because the pressure on the foot is increasing here. Okay, so foot pad pressure increases, integration to the spinal cord happens, goes to the spinal cord, and then your limb extension happens here, just like this. The extension happens, more discharge, less discharge in the flexion. Limb extension happens, and then you can just support your whole body on one limb, just like this guy is doing. Okay, otherwise placing foot, you place a foot on a table. Flexion of the knee happens, flexion of the knee and hip happen, integration at cerebral cortex. This is a slow reflex. It's not fast as monosynaptic reflexes because it's polysynaptic, and because the integration is happening not locally, it's happening on the cortex level. It means you think, it means your consciousness is involved in this. Okay, it's this reflex is done for the firm placement of the foot on the table so that you don't fall from the table, right? Okay, what about dorsum of the foot? Well, dorsum of the foot on the table, you keep dorsum of the foot on the table. Here's the dorsum of the foot on the table, you keep it, and then your sensory receptors, they feel it and they go to the cortex, and then you feel, and your foots are more firmly placed on the table so that you don't fall out of the table. That's the placing reaction. What about writing reflex? Well, just imagine it's a cat, and you will see if your cat falls on the ground, the cat will perform some sort of series of movement to get back on its feet. Okay, so series of body movement, integration is done at the midbrain level of the cat, and then the standing is done. This is how the writing reflex is done. I do this, it's not a reflex. I do this when my back hurts. Usually I lay on my right side of the body, and then I do a series of movement, and then I just stand up if my back hurts. This is amazing for your back. Hopping movement. Okay, so this is a cat. You just make sure your cat is standing on both of its feet, and standing on two legs. The cat moves horizontally, it hops. Okay, it doesn't move. And this is the integration is at the cerebral cortex. Again, it's the thinking, cat is thinking. Cerebral cortex here is midbrain. I think it's quickly hop, postural reflex, so that the cat doesn't fall, because cat doesn't know how to walk on two legs, it just know how to hop. Okay, so this is done for the postural reflex. The last one is mass reflex. Mass reflex, because mass as multiple spinal segments are activated in the reflex. It's a polysynaptic reflex. It's slow and it's not as fast as monosynaptic reflex. In a paraplegic patient, there's a mild painful stimuli somewhere. Profuse sweating will happen because of multiple segments activation. Systolic BP, systolic blood pressure, will go more than 200 mg. It is done due to activation of multiple segment, and the bowel and bladder evacuation will happen. He will try to shit and he will try to pee. So this is mass reflex. So this topic is I think very easy. I think it's not as complex as you think. Again, let's just study the stress reflex again so that it can we can understand it very easily. Stimulus is the physically we change the length of the muscle, and then via the receptor 1A and 2, the spinal cord, and then motor efferent, alpha motor, the contraction happens, and gamma motor neuron is making sure the proprioceptory information is going to the cortex at all time. Okay, so this is the and in inverse of this reflex, in inverse of the reflex, what happens that we try to inhibit alpha motor neuron, and we'll see relaxation of the muscle. So this is the this is the summary, karoche. So this is the whole story of the reflex, and I think that's it.